Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as Gemfibrozil. Its brand name is Lopid. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Gemfibrozil exhibits its lipid-lowering effect primarily through the stimulation of peroxisome proliferator activated receptor alpha. This leads to a decrease in triglyceride levels as well as an increase in high-density lipoprotein levels, or HDL. It may also cause a modest decrease in LDL, but the triglycerides and HDL are the primary two that are affected. So Gemfibrozil is indicated to be used alone or in combination with other lipid-lowering agents to reduce the risk of coronary heart disease in patients with Fredrickson type 2B hyperlipidemia. Gemfibrozil is also indicated to be used as an adjunct to diet in patients who have type 4 or type 5 hyperlipidemia who are also at a risk of developing pancreatitis. Before somebody was to use the medication, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. It's contraindicated to be used in patients with hepatic dysfunction. This would include primary biliary cirrhosis. Patients with a hypersensitivity to Gemfibrozil would not be able to use the medication. It would be contraindicated in patients who have pre-existing gallbladder disease. And finally, it's contraindicated in patients who have severe renal dysfunction. Now, in terms of precautions, the medication should be discontinued if gallstones develop. Patients using this medication may have an increased risk of non-coronary heart-related mortality. Severe anemia, leukopenia, as well as thrombocytopenia and bone marrow hypoplasia have all been reported. A decrease in hemoglobin, hematocrit, as well as white blood cells have been reported. These should be monitored when patients are using Gemfibrozil. Patients using this medication would be at an increased risk of cancer, but this would exclude basal cell carcinoma. Exacerbation of renal insufficiency has occurred, as well as myositis. Now, once somebody is cleared of those contraindications and made aware of the precautions and warnings, and they start using Gemfibrozil, they can expect to take this in tablet form. The dosing for both indications of Gemfibrozil would be the same: 600 milligrams twice daily, 30 minutes before the morning meal and 30 minutes before the evening meal. As with all medications, there are some side effects or adverse reactions that patients may experience while using Gemfibrozil, so I'll list off some of those here now. Just under 10% of patients report abdominal pain. Acute appendicitis can happen up to 1.2% of the time. About 20% of patients experience indigestion. And some more serious but rare side effects would be increases in liver function tests and the development of rhabdomyolysis. That's all we're going to talk about today with Gemfibrozil, or Lopid. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and would like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.